Joining me now from Washington is James Hohmann, national political correspondent for the Washington Post. Thank you so much for being with us, James. We appreciate it. Right away, though, President Trump has met with a number of Republicans this week who do not support this plan. I think that's important to point out because it's a very thin margin as it is to try to get this plan passed. Any indication that these meetings are moving the needle at all?
Yeah, Jamie, I think that they are. It was funny, a couple minutes ago, we just heard some sound from that meeting. Right after that, the president seemed unclear on whether or not the bill had made it through the House Ways and Means Committee yesterday. So he's hands-on in some ways, and he's sort of aloof to the process of Capitol Hill and others. He's never really done anything like this. You know, he has a whole successful career in business, but he's never pushed a major piece of legislation through Congress. What we are seeing, to your question, is a lot of conservatives in the House feel like they can do an end run around their leadership. Paul Ryan and his whip team are telling members of the House, take it or leave it. You're either with us or you're with Nancy Pelosi, the Democratic leader. And the members of the conservative Tea Party Freedom Caucus find that they can come to the White House and basically negotiate with the president and his senior staff. So they're sort of coming on board. And the White House yesterday made some compromises about moving up deadlines, moving up when they would phase out the Medicaid expansion. And then the White House went and told the leaders of Congress, you know, we agreed on this, and they got very, very angry. So this isn't the normal process. Just like with everything with Donald Trump, like him or not, this isn't the way it's normally done. But I do think, you know, Trump has brought some of these conservatives along. The problem, though, real quick, is that when you bring some of those conservatives along, you make concessions that maybe make it harder to get the moderates to vote for the bill. It's not like you just get the conservatives. You have to get 218 votes in the House. You have to get 51 votes in the Senate. And that is a tricky balancing act. And that's frankly why congressional leaders came up with the plan that they did. They thought this was the one that could pass. And they're very worried that Trump's giving away too much.
It's almost like they can't make everybody happy, but they hope to just kind of smooth things over the best that they can for the time being. Speaker Ryan today did say that failing to pass the health care legislation would really be a momentum killer for Republicans. You can't blame them for saying that because it probably would be. How important is it for this deal to get done and done pretty quickly?
The speed is really important. When you talk to people close to Speaker Ryan, they say, you know, if this gets dragged out, if this gets pulled beyond the Easter recess, then it's probably not going to happen. That's why they're trying to get some momentum. Conservatives say, look, we have the majority, we have time. Let's do this in a responsible way. Let's not just try to push something through that we may not think is good public policy. But Ryan thinks, you know, and he keeps saying it, it's either this or nothing. This is our best shot. You may not think it's perfect. One of the problems for Paul Ryan is that a lot of the members of Congress have never been there when there was a Republican president before. They weren't there under George W. Bush.
Good point.
So the whole time they've been in Congress, it's easy to vote no on stuff.
Right.
And so the choice, and this is what Paul Ryan's people are telling me, you know, you have to choose between a half loaf or no loaf of bread, right? And a lot of them or, you know, have never had to make that decision before because they're not the ones who are in charge. And so this is new for some Republican lawmakers. And frankly, it's not clear how it's going to turn out. Paul Ryan's folks, Republican leadership, they express confidence they're going to be able to bend enough arms to get across the finish line. But they've never really been in this sort of situation before. And it is a real test of whether or not some of these people kind of fall in line, to put it bluntly.
Well, and so many of these lawmakers, you know, are hearing from their constituents who have a lot to say one way or the other about this. So I'm sure this is all new for them. We still don't know, though, how much all of this is going to cost. That's a big question mark. The Congressional Budget Office has not weighed in at this point yet. Health and Human Services Secretary Tom Price says even when they do, those numbers shouldn't be trusted. Is the administration preparing for an unfavorable report from the CBO at this point?
Yes, they are, Jamie. The administration expects the numbers to be bad. And frankly, it's not just the CBO. Independent experts expect millions of Americans to lose their health insurance because of this plan. They expect costs to go up for certain kinds of people. And
low-income people, from what it looks like.
Absolutely. Low-income people, seniors. There's a lot of people who are going to be hurt by the plan as it's constituted now. States that expanded Medicaid after 2020 But frankly, that's, Republicans sort of know that to be true, and this is the policy they want. They don't want to just replicate the Affordable Care Act. They want to have something that gives government less of a role. And so what they're doing now is they're trying to delegitimize some of the independent sources. The Congressional Budget Office is actually run by a Republican, but they're doing sort of math, and they're doing the actuarial analysis. And so the Republican leadership expects that the numbers are going to be bad. That's frankly why they didn't wait to roll out the plan until after they had
the numbers.
A number from the Congressional Budget Office. And it's going to end up being a big hot potato on Monday. And then next Wednesday, the Budget Committee, the third House committee, is going to take up the word that they use on the Hill is markup, to go through the bill and basically edit it and amend it. And that's going to end up leading to more changes. So it's still just an incredibly complicated process, and that's just on the House side. Then we have to move over to the Senate.
The Senate, which is a tough battle too. When you get into the nitty-gritty of this bill, the health care bill, one point that people are talking about is that it would drop the addiction treatment mandate covering more than 1 million people. The president has vowed to help in the fight against opioid addiction. So does this kind of undermine those types of promises, and does it contradict some of the language that's been used back and forth?
Yeah, it does, Jamie. That's one of the things is, this legislation does a lot. It's really a huge bill. You're talking about 1/5 of our economy, and you're right, 1.5 million people, based on expert analysis, who currently have access to addiction services because of Medicaid expansion, would lose them under the plan as it stands now. And the opioid epidemic is such a problem in this country. Donald Trump talked about it all the time on the campaign trail. It's a huge issue in some of the states where he did best, like Ohio, New Hampshire, the upper Midwest. And so, I think, now people are saying, well, we can walk it back, we can change it. But this stuff costs money. That's the thing, is every time, all the popular stuff is really expensive.
Right.
So you say, okay, let's give 1.5 million people addiction services. So you're talking about, billions of dollars a year. And so Republicans are looking to cut costs. They're looking to make this, deficit neutral. And that requires making really tough cuts that just sound really bad and are really hard to defend when you go back home to your state or your district and say, yeah, I took away coverage for people who have, serious drug addictions. Yeah.
It's very tricky. We'll see how it all gets sorted out. James Hohmann in Washington, thank you so much.
My pleasure.